Next in our webinar, we're going to do a deep dive on the pediatric epilepsy surgery journey in particular. And joining us is Dr. Christine Baca. She's an adult neurologist, but she has specific interest in health services for persons with epilepsy, as well as the transition from pediatric to adult care. Audrey Vernick, who's the director of our Patient and Family Advocacy, is joining us as well. She has a son who had hemispherotomy for seizures caused by stroke. And Michelle Mottern, a nurse practitioner who's a member of our Community Advisory Council, joins us. She has a son who had hemispherotomy for seizures caused by Rasmussen's encephalitis. Everyone, welcome. Dr. Baca, if you could just start with telling us a little bit about the papers you've written about the journey that parents face when they're on the road to pediatric epilepsy surgery for their child.
Sure. And thank you, Monika, for having me here today. As you noted, it is kind of maybe perhaps funny. I'm an adult epilepsy doctor, but I have an interest in what we call health services. So things related to how we access care, how we coordinate care, and understanding perhaps delays in care. And during my training, I had observed a lot of delays in care when it came to epilepsy surgery as a whole for pediatrics and adults. And really what I wanted to understand was why is this happening? And really the key to always understanding this is go to the stakeholders, right? So the stakeholders that I went to for understanding this pediatric epilepsy surgery delay were the parents. Now, obviously, they're not the only stakeholders. There's many other stakeholders in the process, but really hearing their voice was really important. And a lot of people may think of research as crunching numbers all the time. And really what this research was having an interview guide whereby I would ask parents open-ended questions and really understand their journey from diagnosis to epilepsy surgery and beyond. And in hearing that journey, we heard a lot of themes. Now, everybody's journey is different, but there were a lot of shared themes. And what I'm here to talk to you today about were those shared themes. And as the slide shows, it was really, for many parents, it felt like a journey around the world. And I think that journey was really separated into kind of 4 key stages. The first stage was a recognition stage. That stage where you're searching for a diagnosis, trying to understand what's going on. Many parents had never seen a seizure before, didn't know what was happening, didn't understand what was going on. And it took sometimes having a very scary situations with seizures occurring for parents to then reach out and seek emergency medical care because it was very obvious at that point that there was something wrong. But often it wasn't clear at first what the nature of that quote wrong issue was. And it took kind of learning and recognizing and becoming familiar with epilepsy. And that really was kind of the next stage, which was a searching and finding. So parents, upon learning that their child was having seizures and recurrent seizures, really started a new journey whereby they were information seekers, trying to understand what is epilepsy, what are seizures, how do we treat them? And this journey involved finding doctors. Many of you may know and experience in different ways that the medical system is kind of complicated. And understanding who is who in this system can be a little bit crazy sometimes. So, for example, we have pediatricians that take care of children. We have general neurologists that take care of children and adults. We have pediatric epileptologists. Now, most people have never used the word epileptologist in their everyday language unless it really necessitates seeing a doctor who specializes in seizures. But in order to find that doctor, sometimes you need to start learning the lingo. And that's a process in itself. And unfortunately, it's a process that's quite burdensome for parents and other people navigating the system. And so oftentimes it takes finding that pediatric epileptologist to kind of get to the right place. And that can often involve seeing many doctors before you get there. And along the way, with multiple doctors, there were often multiple medications, multiple medications, many trials and errors and not understanding what's going on, why aren't things getting better, and where are we going, kind of what's our direction. In conjunction with that, I heard many stories about insurance obstacles, people changing their insurance, changing their employment to change their insurance. It was mind-boggling to hear, actually. And as you can imagine, as I've stated, all of these things, the information seeking, the finding the right doctors, the multiple medications, the insurance obstacles, that leads to stress, right? A huge parental stress. And often it was stress that people experienced in isolation. Because oftentimes this is happening in a world that feels like nothing, that this is my child and it's happening to my child, but it's not happening to my neighbor's child, it's not happening to my friends, and I'm all alone in this journey. Throughout this journey, people start hearing things in addition to medication, such as surgical treatments. And initially when people start hearing this and parents would hear surgical treatments, I mean, brain surgery, that sounds very scary. And for most people, that sounds like something that's a last resort.
I heard it. I just wanted to say, I heard when my son was 4 days old that he would have to have half his brain removed. And I just remember thinking, wait a second, isn't he going to need that? I mean, I couldn't even process it. It didn't make sense. I often say to parents, you feel like you got shoved down the rabbit hole, right? Nothing makes sense in our world sometimes.
Yeah, I think you're spot on with that statement, and that experience. It was common to a number of parents, whether it's at 4 days of life or 15 years of age. Oftentimes, hearing the word surgery is terrifying. It feels like, well, can't we do something else before we do that? And what's going to happen to my child if you take out, or disconnect half the brain, right? What I also heard, and I'm wondering, as we sit here and talk about this, is many parents also, over time, the epilepsy became so severe and seizures were not controlled, and other things were happening as a result of the seizures, loss of development or lack of attainment of certain developmental milestones, that in some ways there was almost like a flip. And I don't mean to say that that flip occurred in one day. It was a process, no doubt, where surgery then really felt like it was the best option. And it was a shift from kind of thinking of it as a last resort to hoping, can we be a candidate for it so that something will work and help my child? So all the parents I interviewed were parents whose children had undergone surgery, by the way. And so then after surgery, there was kind of a new process, irrespective of outcome, really. So whether the children did very well with surgery and had total cure from their seizures or improved, but without a cure, there was kind of this sense that parents had of wanting to give back in a kind of a new life that they have. It was a new phase, a new journey. And in that phase, they often voiced kind of a feeling like they wanted to give back to other parents that were back in that recognition phase, or the searching and finding, or kind of tossing that surgical option up in the air. Is that a last resort, or is that something that's very hopeful, and helping other parents work through it? So it was really a journey of many ups and downs, twists and turns. But these were things we found amongst many parents whose children had undergone epilepsy surgery.
I think that's all very familiar to us. I think the searching and finding piece is probably the most excruciating part of the journey, is that jumbled mess you're in before surgery, where you're just trying to figure out what's going on. Maybe we could just quickly talk about all the different pieces of that searching and finding part of the journey.
Yeah, I think it was summed up really, and you have one of the quotes there. It was a journey around the world. It was very circuitous.
Mm-hmm.
And that was one parent's exact words. And as I, kind of mentioned a little bit before, there was definitely this information seeking period. And it was kind of becoming an expert in your own right in epilepsy, not because you wanted to, but because you were forced to, right? And then there's information from innumerable sources, right? We've all been on the internet now. The internet can be full of great information and horrifically wrong or terrifying information. And then we have our physicians, and you go to your physicians, and some of them, may be very familiar with this, and some of them it's not a familiar thing at all. So I think that it's very challenging, this information seeking and navigation part of this journey. And maybe I could just reflect upon a couple quotes that some parents actually stated, because I actually think sometimes me talking about their words is not as good as just hearing the words themselves.
Yes, please.
So one quote was, I mean, you've heard of epilepsy, but so it was pretty much an avalanche of information coming at us. So we didn't, in the beginning, have a clue. It wasn't that easy to find information. And I think that avalanche kind of feeling was a feeling that was expressed, whether stated in those explicit words or not, that was echoed in a number of parents' statements. And, sometimes too much information is just that, it's overwhelming. How do you filter the information, right? How do you find the things that you need to help your child and to stay sane in the process? And it's this issue of doctors. Many patients voiced a challenge finding that right doctor. And by right doctor, it could mean a number of things. That right doctor could be, finding a pediatric neurologist or epileptologist that was highly skilled in the management of seizures and epilepsy, and knew all the medications to use and knew about surgery and had a good relationship with a surgeon to make that link. But it could also be somebody who maybe wasn't an expert, but was somebody who was a champion for a parent and really helped kind of, help them navigate the world and was a good listener in that regard. So it didn't mean that it was always the expert, but it was finding that right doctor, and that came in different forms. Another quote here about the doctors and hospitals was, "We've been bouncing around hospitals for 4 or 5 months. Not that care was poor, don't get me wrong, but there's a point where it surpasses the local specialty." So sometimes people just lived in areas, where finding that person was really, really challenging. And they often had to travel great distances to find that right doctor. Parents spoke about the medications, that, in some ways, medications help seizures, but it came to a point where, it's like another medication trial. It's not helping. Why do we keep doing this? Where are we going to next? And it didn't feel like there was direction in moving forward in that regard. Another quote here is, "When the medications continued to fail and we were on number 4 and number 5 and none of it was working, her seizures were getting worse, her behaviors were worse, and there were side effects. She would lose her short-term memory. She wasn't learning. Some days, all she did was seize and sleep. It was the medications. We kept trying more medications. Nothing was helping our daughters." And it was like this expression almost of going around and around in a circle and not making any progress. And whilst the meds are supposed to help the seizures, the medications were also causing a lot of problems, right? They're not side effect free. They come with a host of side effects.
Right.
So there was additional obstacles related to insurance. Many had to change their insurance in order to either find that right doctor or have approval for a certain diagnostic test. As you all know, the road to surgery, even once you kind of make that right connection, quote unquote, with the expert who knows the test to order, it's a lot of tests, or it can be a lot of tests, and making sure they're all covered by insurance. Some parents basically spent their jobs or their time, it was like a full-time job, fighting with the insurance companies. One parent said, "We had quite a fight with the insurance company to get the MEG approved. And actually, because of that fight, our insurance changed our protocol concerning Meg and epilepsy. So sometimes all the fights and all the obstacles did actually make change, but there was a lot of sweat equity put into that to make that happen. And parents often expressed, extreme stress, and dealing with these insurance obstacles, the medications, the side effects from the medications, finding the right doctor or not finding the right doctor, dealing with all the information that you're trying to decipher through, navigate this system of specialists or non-specialists, and who do you go see, and just becoming empowered along the way. Many of them felt highly disempowered, as it felt so stressful. And unfortunately, as I mentioned before, much of that stress is occurring with people really not understanding. We all know that epilepsy as a whole is largely misunderstood, and there's obviously a lot of stigma regarding epilepsy. Now kind of compound that with really complex epilepsy, where patients and the children are having, sometimes hundreds of seizures a day, and you're navigating this system. And so the stress is just something that most people can't really understand. And in that regard, it's very lonely.
And the seizures just pop out of nowhere for so many of us. You don't even know when they're going to happen or when your child is going to cluster. So you're on pins and needles all day or all night because you're just waiting for the next cluster. It's so difficult for our families.
Mm-hmm. Yeah, I would agree. I mean, epilepsy, intrinsic to what epilepsy is and the nature of seizures, they are intrinsically unpredictable. And so parents are living in this state of enormous stress with a disease intrinsically that you never know when something is going to happen or something is going to change. And many of them expressed a feeling of complete lack of control. And one of the ways of gaining some control was to become experts in epilepsy, to care for their children, and to figure out how to navigate through this journey. So yes, and the journey involved a journey as parents kind of conceptualize surgery in and of itself. And one parent said it was finding the right spot. And it's not only the right spot in the brain that the doctors figure out, it's really the right spot for that parent in their kind of feeling of readiness, so to speak. In the beginning of their journey, and by beginning, let me clarify something. For some parents, the beginning isn't necessarily days and days or years and years. It could be early on in their journey, and for some parents, it could be later on in the journey. The concept of time was something that was also, the perception of time in the experience of the searching and navigating, even if it was, quote, not a long time in years from one parent compared to another parent. For example, if one parent it was 1 year versus another parent it was 5 years, to both parents it felt like an eternity. And so it was kind of an interesting perception of time, because you are in such high stress. But in that moment, in that time period, parents would start to hear about surgery either from the doctors or from other sources. And depending upon those sources, or depending upon, delivery of the physician, sometimes that felt horribly scary. Now, even with the best bedside manner, brain surgery is going to sound terrifying, right? It is cutting your child's brain. The brain is who we are as human beings, our personalities, and somehow that feels threatening that will be lost in this process. And so many parents kept thinking, oh, there's got to be something else we can do. There's got to be another medication. That's a last resort. That's a last resort. But as time went on in the journey, many parents went through an experience whereby the feeling of surgery as being a last resort kind of changed over time, because the epilepsy itself and the seizures and the unpredictability and life kind of in this existence of being very isolated in such high stress became worse than the concept of the surgery itself. And in that regard, surgery actually started to look as a hopeful opportunity for many parents, that there could be a cure there, and if not a cure, at least palliation in the frequency and the severity of the seizures, and for some, perhaps a improvement in a developmental trajectory. And so there was hope for surgery. As parents went through it, the epilepsy became scarier than the surgery, and they were hoping for the surgical candidacy. And really, then it became about where are we going to get this? Who's going to help us? Where do we go? And how do we find that exact right spot in the brain? Because that right spot for them had been found kind of in their family, and they knew they were there. So that's, I don't know if that was experienced by anybody here on the panel, is kind of that kind of process in itself, as surgery changing in your head as you went through the journey.
I think, Michelle, we've talked about this, how your road to surgery for your son was quite interesting. If you want to let us know, share it now, but it certainly wasn't something that was offered as fast as it maybe should have been, right?
Right, yes. So my son started seizing when he was 4 years old, and it was pretty much out of the blue. His eventual diagnosis was Rasmussen's encephalitis, but it took a long time to get to that place, and he started seizing. I'd never seen a seizure before, and I recognized it as a seizure for some, because what happened with him is he just kind of checked out, and I saw that nothing was there, and it startled me, and I thought, I don't know, the word seizure just popped into my mind, and from that point on, he ended up going to the hospital, which was the local hospital in the small town where I live. I'm actually between two large cities, but in a small town, and he ended up seizing a couple more times in the hospital and being transferred to Orlando, because where we were, they didn't have the specialist for pediatrics. They didn't have a neurology specialist for pediatrics. So I ended up going with the doctor that saw him in the hospital, because I didn't know any better. I just thought, well, he knows what he's doing, and we'll just go with him. And from that point on, it became medication trial after medication trial, with no results. And with my son, his seizures, a lot of times with Rasmussen's, there's multiple seizures in a day. Well, his were not like that. He would have 2 seizures a week, or 4 seizures a week, or 1 seizure a week. It was very, but he was always seizing at least once a week, at least twice a week. And so we knew the medications weren't working, and we went through years of medication trials and just hoping that at one point something would work. And then we ended up going to Miami to see a different doctor who kind of toyed around with the Rasmussen diagnosis, and he did a functional MRI on Lucas, and ended up suggesting that we do IVIG therapy, because he was concerned that Lucas's language hadn't transferred to so Lucas's problem was on the left side, the left hemisphere. So Lucas's language hadn't transferred, which is what he was hoping would have happened. And because of that, he didn't really push for surgery. And at that point, everything that the doctor spoke about resonates with me, because brain surgery was a horrible scenario to think about. And I just wanted a medication to work, and it didn't. So we ended up going with the IV therapy, and we would travel to Miami once a month and get this therapy. My son hated it. He was like 7 or 8 years old, I think, at that point. And we did that for almost 2 years. It seemed like almost 2 years. And
wow, it's a long time.
It was ridiculous.
Yeah.
It was a long time, and it did seem to help a little bit, but it never stopped the seizures. And so then I asked the doctor that we had in Orlando, what about this vagal nerve stimulator? Because like the doctor had said, I was researching, looking into everything possible. And, but at no point did anyone who were the experts advocate to me surgery. And here I am, just a mom trying to be everything for my son. And I was terrified of surgery. No one had presented it in a way that made it sound great, and no one had really presented it. I mean, it was just said, well, these are the different ways that we treat resistant epilepsy. If they don't do well with the medications, then there's a diet, and there's different things. And we tried the VNS, it didn't work.
Because if I can interrupt you, what's interesting is that the rule or the guidelines of both the American Academy of Neurology and the ILAE say once you're at drug resistance, which is 2, you're supposed to be referred for a surgical evaluation. It doesn't say you're supposed to just keep trying and trying and trying more drugs. And it also is pretty clear in the research that most children with Rasmussen's need hemispherotomy. That seems easy to me in terms of telling you what you should start to explore. And it's so curious that you weren't told. I don't understand it. Let's move to the next slide real quick. Life now.
Yeah, so the life now is really kind of the post-surgery life, which for some parents involved a child who is now seizure-free. And for other parents, it did not mean that the child was completely seizure-free, but for most, it involved some difference that was a positive difference, either through kind of improvement of seizure frequency, seizure severity, quality of life indirectly, or development. And really, this journey to surgery was one that we took the steps we needed to, and now here's this new journey that parents were embarking on, and it was life-changing. And in some ways, it felt like to many parents kind of expressed this notion that once they're in that post-surgery phase, it felt like an eternity ago that this journey to surgery happened. It almost felt like a different life. And so for many parents, they wanted to give back and give back to their community. And really, for most parents, what that meant was helping other parents. And I think I go to kind of that, their expression of that feeling of horrific stress during that time of searching and finding, where I think many parents recognized nobody should feel that way all by themselves and alone, and that they could be a resource for another parent and help them, either be just a support system, a champion, and in many ways just help other parents. And so that's what many parents set out to do in that life now phase.
Which I think is what we're trying to do here, right? So you had another paper, I think I was interviewed for this paper now that I think back on it, called The Slow and Arduous Time to Pediatric Epilepsy Surgery Journey. And you had sort of 4 overarching themes, but I love how you included it was 5 years of hell in the title of the paper, because I think that is something that most of us parents talk about is just how awful that time before surgery is. Emma, we could talk about this paper a little bit.
Yeah, so the parents expressed exactly what you've just stated, which is that this journey felt like hell, and it was extremely slow, and it was arduous. And remember the parent who kind of stated that an avalanche was coming toward them with all the information. And so really parents kind of expressed kind of going through two things during this time period. That was which were a processing, a feeling that they're processing information and working through feelings, etc. And I can talk about more of that in a second, but also simultaneously, kind of concurrent to processing, they were also navigating. So they were doing these two things at the same time. And so the processing really involved kind of processing the diagnosis and the severity of the epilepsy, and processing the decision for the surgical treatment. Navigating included things like navigating, for example, the health insurance and all the complexities of our healthcare system, and navigating all the numerous treatments before surgical consideration. And really what ended up happening was that through processing and navigation, those two things kind of intersected in a way that parents became epilepsy experts in themselves. And it allowed them to really take deliberate steps and actions that they needed to do, and really be peer supporters to other people down the road and help others with navigation and processing. Something just popped on my computer. So this diagram, actually, I think I'm somebody who's very visual intrinsically, so I like to draw pictures of things to help me kind of describe things. And so really what you have in the beginning here is the onset of epilepsy and the seizures. And as you can see, you then have these simultaneously occurring processes that are not always completely aligned, but they often intersect, whereby parents are navigating a multitude of things, as I've mentioned, but also processing all of this all at the same time. And they're doing this, it just feels incredibly slow and arduous. And so as you can see from this diagram, kind of from the very beginning to the end where it says epilepsy surgery, that's your total time to surgery. And that could be in years for many parents and children. For others, it may be, less than a year. But the time from the onset of the seizures and the epilepsy diagnosis to when they kind of find and get to the right place where they're starting to really consider surgery and be hopeful, and it looks more like it's viable, and really start that pre-surgical referral, where they're kind of embraced by a team of people, because it involves multiple people with multiple expertise to really take patients through epilepsy surgery evaluations. That time period for many is the longest time period in duration of the whole time to surgery, but it also feels often like the longest time, because there was no kind of direction at first in getting there. There was oftentimes going in circles of navigation and processing, and finally they get there. And often it's through peer support, and like we're doing now, and reaching out to other parents, and also champions. And those champions can come in a number of different forms. They can be other parents, they can also be doctors. And as I mentioned before, kind of those doctors can be doctors who are experts in epilepsy, or they could be doctors who are, just helping parents to navigate and get to the right place or institution, and other doctors. And and they kind of move the process forward such that families really get to a state where they're in the team, and they're followed by a team, and through that evaluation, and get to the epilepsy surgery.
Audrey, I know you specifically had a champion neurologist on your side. How did you find that neurologist that led you to surgery?
Dumb luck, honestly, and a connection with a friend. I can tell a little bit of how he got there if you'd like me to, or so. My son was, we had a challenging labor and delivery, but after 4 days came home and thought everything was fine. And I'd say at about 2 months, he started having what were called colic episodes, or Moro reflexes. This is what I kept being told. Later, looking through the notes, there was a strong preferential gaze to the left, because he had a right hemisphere stroke and he couldn't see anything on the left, so he would turn his head all the time. But we didn't know any of this. And it was Mother's Day. He was 5 months old, and he basically seized all day long. We still didn't know it was seizures. but he was crying inconsolably. He would have these Moro startle reflexes, which at 5 months, I now know you're not supposed to have. And then just screaming, crying, inconsolable. So we got a hold of the pediatrician, had a meeting with her, and she said, okay, I'm gonna refer you to a neurologist, and gave me some names. And I spent the day calling every single pediatric neurologist in my area, of which there are many because I live in a major metropolitan area. And it was like, oh, we can see your baby in 2 months. And so I had this baby who was, you know, I knew, so now I know when they say we're referring to a neurologist, I still didn't really understand seizures. And late at night, texting, emailing friends back and forth through a friend of a friend, someone said, you need to contact this neurologist, Dr. Luis Bello Espinosa. And I emailed his office. It was 9 o'clock on a Tuesday night. At 9:45 p.m., I got an email from his nurse saying, Dr. Bello will meet you tomorrow morning at the hospital. He's admitting you for a 24-hour video EEG. And then that was the beginning of our journey. And he really stuck with us all the way through the surgery, which ended up being more than 2 years later. But it was incredible. Without him, we would have had a very different journey. It still took us a while because we had some other bureaucratic hurdles along the way, but that we were incredibly lucky to get him and, you know, to just recognize the emergency that you know, the description of what my son was experiencing, he recognized it as an emergency, whereas all the other neurologists we contacted didn't have that screening process, or they just didn't consider it urgent.
Michelle, did you have a champion on your side that was leading you to surgery? It sounds like you probably did not.
I didn't. I really just, in a way, navigated through it myself. But other than the IVIG therapy that was suggested, I asked for, at one point, I asked the doctor that was treating lupus, you know, these medications don't seem to be working. They're not working. And he said, well, your son doesn't have seizures as bad as some of my clients, you know. I know. And then I startled back at that, and he goes, well, and then he quickly backstepped and said, well, I know every seizure is bad, but you know, sometimes it takes even 3 medications to stop the seizures. So what led me to seek surgery was the behaviors, because my son, his behaviors went to such a dark place that I wouldn't wish that anybody. It was awful. It was more of a mental health issue at that point for my son. And when you see your child go into a sullen, dark place where they just sit and growl at you pretty much if you talk to them, it's awful. And I was like, okay, I asked, there was a nurse practitioner who was seeing us for yet another medication switch or something. And I said, what, is there a place where we could get this? I've heard of this grid mapping where they can look and try to find the seizures. And she's like, oh yeah, I can refer you up. We were in the same building. It's my doctor. So the team that we ended up with, who was amazing, who operated on Lucas for the hemispherotomy, they were in the same building the whole time as the doctor who was medicating and medicating and medicating my son. So it's my, I sometimes wonder if, I don't know if I don't know how it ended up the way it did for me, because I've gone over the details so many times thinking it was something I said that nobody thought I wanted. I would go for surgery because I was open to anything, but of course surgery is scary. But what I wish would have happened in my scenario is that someone would have said, have you considered surgery? You know, this is what is going on. Your son's not responding to medications, probably never will. You know, have you, and then let me come to my place for the surgery, say, you know, let me as a parent come to meet you halfway. You know, it was, but it wasn't really ever brought up. I had to seek it out myself. And
I feel really strongly about this, that epilepsy surgery is a treatment that is being withheld from many parents as an option, that some decisions are being made about treatment without having the parent involved. We really shouldn't have a situation where a parent says, I didn't even know you could have surgery. The guidelines are clear with these two very well-known organizations for the physicians. I'm sticking my neck out here a little bit. And it says after the person fails two, when you're drug resistant, you're supposed to be referred for an evaluation. And I can't believe, Michelle, that it happened to you just a few years ago, and it happened to Audrey 15, 16, 17 years ago. It's like we haven't made much progress at all.
Can I add to that? There's also, it's not just the two failed meds. There are certain conditions that lend themselves to surgery that are not going to be treated with medication. So when you're looking at, my son had a massive stroke in utero. So after the 24-hour video EEG monitoring, we went and looked at the MRI, and I walked in and saw my baby's brain on the monitor, and my heart stopped. Because I was like, what happened to he had a lake in the right hemisphere of his brain. That's, if you're not going to talk to that family about surgery, which family are you going to talk to about surgery? And with Rasmussen encephalitis, we know that is going to, most likely surgery is going to be necessary. So it's beyond the medication piece. It's also looking at what is the underlying history that's leading the patient there, and there needs to really be some understanding there.
And the good news is we'll have a webinar just exactly on that topic, is when you should consider surgery. So I think this is probably a good time for us to close out on this webinar. Thank you so much for doing this for our community. Dr. Baca, I really appreciate you working with us here, and I hope we've hooked you, and I hope we can collaborate with you in the future. And Audrey and Michelle, thank you for everything you do in terms of Michelle donating your time to the Community Advisory Council, Audrey working with us as the Director of Patient and Family Advocacy. You're just doing such a terrific job of changing the world for our community. So thanks so much for participating today.
Thank you.
Thank you for having us. Yes.